Amy Toth is a physical therapist turned chronic pain specialist with over 20 years of experience. She is on a mission to help motivated humans who are ready to move out of debilitating pain and start enjoying life again. With a unique blend of compassion, expertise, and humor, she has become a trusted mentor, teaching countless individuals how to recover from chronic pain by regulating and reprogramming their nervous system. Amy has a 12-week coaching program called the Chronic Pain Recovery Method and a Facebook group, the Chronic Pain Recovery Community, which you can find linked in the show notes below. She also has a free guide for you called Life Hacks: 3 Ways to Ease What Hurts, Even If It's Too Hard to Get Out of Bed. And you can also find the link for that in my show notes below. The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe, while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learned here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence. Before we start today, I have a question for you all, and that is, if you couldn't talk, write, or type, how would you get your needs met? I want you to think about this as we're going through this interview, and if you're open to writing into the show, please leave a comment on YouTube or DM me on Instagram and let me know your answer. If you couldn't talk, write, or type, how would you get your needs met? This is a tricky one, so I'm looking forward to your answers. And speaking of getting your needs met, if you are a therapist, and especially a newer therapist, either you're fresh out of grad school or you just started a private practice and you're looking into how to incorporate more self-care and boundaries and all of that good stuff, Jennifer Hama, my good friend, has a new clinician expo on Friday, June 14th at 9 a.m. to 4:30. It comes with 6 synchronous hours approved through Georgia's board, so this is specific to Georgia. However, even if you can't get CEs for it, it is a phenomenal price. I honestly don't even want to give the discount code out because Jennifer has put such a good day together for honestly what's already the lowest price around. However, if you are a listener, then you can get 50% off with the code that I will put in the show notes below. The topics that we'll be talking about is how to network as a new therapist, helping clients get past the 5 stages of grief, counseling men in relationships, working with body image, creating a successful virtual practice as a therapist, and the one I'm doing is called Embodied Empathy, Your Physical Health in Mental Health Work. So we'll be talking about the intersection between personal experience with chronic pain and the physical impacts of being a therapist around our emotional work. So I'm really looking forward to seeing you there. If you're a therapist, that link is in the show notes below with a discount code for 50% off, making this a full day workshop for $30. Truly, this is like Jennifer puts on an amazing lineup every year, and $30 it's nothing for what you get. So I hope you'll sign up below. I also have my monthly workshops still going on. The next one is June 8th. It's how to reach out without feeling like a burden. If you were at the last one a couple months ago, it was the same title, but this one's going to be completely different. All new, brand new materials, but it's the same theme. So please feel free to sign up again, even if you went to the reaching out one a couple months ago. That one is June 8th at 10 a.m. And then July 6th at 10 a.m., living with ADHD and chronic pain or illness, because there's such a huge overlap. I'll be doing a workshop on that. And then in August, the workshop is going to be all about Lyme disease. And I'm bringing on Dr. Frank Song, who is a phenomenal naturopathic doctor in Connecticut and Vermont. So that is a lot of the hub of Lyme disease is up there in New England, which is where I'm from. And I'm really excited to have, and that one's going to be a 2-hour workshop because we're going to be really diving deep. And this will also be an opportunity for kind of a support group, Q&A type environment. So I really hope you'll make it to any of those. You can find the link for that in the show notes below. Why don't we start then by you telling us a little bit about who you are, where you practice, what you do.
Yeah. So my name is Amy Toth. I am a physical therapist. I've been doing this for since I graduated in 1999. So I've been doing it for a little while. I am in the state of Minnesota in the Twin Cities area. I currently still have do some in person. I still work in a clinic, as well as now am expanding my reach to the online world to be more specific to helping individuals with chronic or um, persistent pain.
Awesome. And so, tell us maybe a little bit about your most common client. Like, who do you kind of see in your practice, and how do
Yeah,
we help them?
I see. I mean, a lot of it would be people who they may have had a not usually not a new diagnosis, but usually it's been years, if not decade or two. A lot of kind of like neck, back issues, potentially more. So I'd say, I mean, average, probably people more in their like 40s and 50s and 60s, probably for the most part. Women more than men, which kind of is more, I think, a byproduct of women sometimes tend to seek help more and those kinds of things. Um, and so a lot of people dealing with issues for decades, they may have only recently had a diagnosis. Um, and then so they're sent to physical therapy. Um, and they oftentimes have had multiple other episodes of physical therapy, most of which either did nothing or made things worse. So, I tend to get a lot of people who kind of been through the system who aren't really who came because their doctor told them to, but they aren't all that convinced I'm going to be able to do anything for them. Um, so it's a lot of so I spent a lot of time like explaining how it works. Explaining how when you've had pain for a longer period of time, your nervous system just starts to work differently than if it's I hate calling it regular pain, but I haven't come up with a good word. Or like other I'm working on episodic pain. That might be a little bit better phrase for it, but how it works differently. Um, and I really enjoy seeing like the light bulb come on. Because I think um there's a one that I think there's a lot of fear and anxiety around, like, no one can tell me, like, what's going on, or no one can tell me why I have all these symptoms. Um, and so that's always kind of like the funnest part to see is this whole, well, it kind of makes sense. And it's not just like all in my head, like some people have been told. Like one of my most recent clients, when I was talking with her, she had a neurology appointment and like literally like, he doctor comes in and is looking through the chart and like first thing he tells her is she needs to go see a psychiatrist. I'm like, no exam, no discussion. I'm like, what? So it continues to boggle my mind that these things unfortunately are not like one-off incidences. They continue to happen every day.
Yeah, I they do. They do. And I also work with his clients too. And I've mentioned before on the podcast, but that's kind of my own. Like it took me a long time to get a diagnosis, not because I was going from doctor to doctor and not getting answers. It was because I wouldn't go to the doctor because I saw that my mom, like, she kind of went through that, just
Oh,
answers, and it's all in your head, and you're just being dramatic and all of that. So I just didn't want to go to a doctor because I was like, what can they do for me? They're not going to do anything.
not, and it's
but
true. And I still, this one that I still haven't quite like, I mean, a lot of the science has been around for, I mean, it's still relatively new, but it's been 10, 15 years that we've kind of really started to realize like the reason people have persistent pain is not necessarily because they have what I call like a tissue issue. It's not because like there's the arthritis or there's the whatever. It's because your nervous system has changed how it worked and how that has not trickled down into more like common knowledge among at least specialty physicians. It like, yeah, it's boggling of the mind oftentimes.
It's true. I mean, I find myself even still scared to do that education with clients because I'm so scared to get it wrong and make someone feel like it's in their head.
It is,
So
it is, it is a very, yes, it's a fine line and it's very tricky. And that's why I often find myself doing it in bits and pieces. Um, and kind of trying to gauge like how much like trust and buy-in am I getting before I kind of go to the next phase.
right.
Um, and then a lot of repeating like your pain is 100% real, but it's because of these processes more so than like this structural issue that, we've kind of been taught uh,
Yeah.
that and that's probably where it started. It has just, that's not where it has ended up.
Yeah. I kind of simplify that by just saying your brain is just overprotective of that area. There was damage there, or there was something there. And even if you're okay in that area now, the brain is still saying, hold on. We like really want to protect this area. So let's be really careful and cautious and
Yeah.
what that looks like, what your kind of careful and cautious looks like. It varies from person to person. For some people, that's laying in bed when they're in pain. For other people, that's maybe going for a walk instead of hitting the gym hard. Or maybe it's, oh, I gotta push through this pain. And so anyway, it looks different for everyone, which is why what you're saying, like it takes we don't just throw this information
Yeah.
at you as a client or a patient when you're coming in, because we have to know where you're at and we want to be on the same page and the same team as you. But how do you explain to people kind of what is happening in their body when they feel all this pain around the bulging disc that they have, that the MRI proves they have? Like, how do you what would be an explanation you would give to somebody?
Yeah. So I do a couple things. One, I try and give like some analogies and supporting evidence so to like show that I'm not just making this up. Um, and that you can take a room full of people with no back pain, give them all MRIs, and 30 to 40% of them will have abnormal findings. So you can have an MRI and you can take two people who have equally, let's say, equally bad looking MRIs. One person might have debilitating pain and one person doesn't. So the imaging does not correlate or determine the level of pain. So just because you have an MRI that maybe they told you looks like the spine of a 90-year-old does not mean your spine's going to feel like the spine of a 90-year-old. There's so many other factors that go into it. And then I talk about kind of basically your nervous system has made adaptations. So that instead of being like normally, let's say you bought a new car that had a car alarm on it, it's like default factory setting is that the alarm's going to go off if someone breaks the windshield. And that's kind of like your body before, your nervous system, kind of before you start having all this pain. And then once you've developed this pain, it's more like that alarm system, like the default has been set to go down. It's been set so sensitive that if the wind blows really hard, the car alarm is going to go off. So that's why, and obviously, the wind is not, in most cases, unless you're in a hurricane, the wind is not sufficient enough to cause damage to your car. But at the moment, since that alarm is set so sensitive, it is sufficient enough to set the alarm off. So that's why, now maybe you used to be able to go for an hour walk and now you can only go for 20, 30 minutes because the sensitivity of your nervous system is dialed down. So now at 20 minutes, your nerves are going to send signal. That doesn't necessarily mean that the windshield is breaking. Doesn't necessarily mean you were damaging anything. It just means your sensitivity is set low enough that it's now going to send signals. So that's kind of how that's how I start. I usually start with that sensitivity of the nerves themselves piece. And then after that, that kind of starts to make sense. Then kind of talk about some of the like the top down, like then what does your brain decide to do with it all piece.
Yeah, I'm curious how then we start to build intuition around what maybe is painful and damaging and what isn't.
Yeah, that is tricky because a lot of times when you've had pain for a while, you either it seems to go on extremes. You either ignore it or you're paying attention to absolutely every little sensation you ever might have. Um, and yeah, and this is the key. This is the tricky part. I think some of it and everybody, I think it can be a little bit different for everybody because there are some people who are fairly body aware and some people who are not. So the people who are really body aware, trying to kind of, you know, tease out like, yeah, exactly. They will tend to like if you truly ask them, like, well, does it feel like this is something that is going to be good or bad if you keep doing it? So those people can, if they can start kind of tuning into kind of that internal sense. For the people who are not very money aware, sometimes I go more of a like, okay, well, how long do you think you could do X activity for before it would start to bother you? And then we just have to set like, okay, if you can do that for 10 minutes, you need to stop at 8 and just kind of start building things that way and kind of a little more uh, awareness and kind of that kind of perspective.
Yeah. Yeah. And then as you do these practices, and especially if you bring in some mindfulness work, you start to
Yeah.
realize what's changing for you. You
Yeah.
can't, I think a thing sometimes we can get caught up with is, okay, give me this thing to do. And you just gave two really great things.
Yeah.
Oh, do 8 minutes instead of 10 if you're not as body aware. But it's like you take that, you do the thing, then you check in with yourself, find some reflect with
Yeah.
that. That's how you build that intuition. So I think I'm just exemplifying here why it's so important to work with people, but also do your own like personal development work too. And those things just go hand in hand. You can't really
And
do
it's
one without the.
well, yeah, and I think that's like, that comes back to the challenge of like not telling people that it's all in their head is like the original definition of pain is like a sensory and emotional experience. So like it automatically combines like the mind and the body. It's not all one and it's not all the other. Um and in general, like in my work, I tend to leave the mind stuff till a little bit later because I feel like people are familiar with the body stuff and that's like and then once we're starting to notice improvements, then there's a little to be honest, there's a little more of a trust factor that I might know what I'm doing. And then and then kind of start more towards the end is where I talk about, okay, we've gotten your nervous system calmed down. We have the connection between your body and brain going a little bit better. Now, if we want to keep this going, we need to look at some of like potentially like either the thought patterns that have fed into it, but also life circumstances that has fed into it. Because if you have certain relationships or certain other things that are continuous, like constant sources of stress, you're going to keep flooding your system with cortisol and all those other hormones. And it's going to be really hard to keep your nervous system kind of dampened down. Um,
Yeah. I just a point on that. I tend to, when we kind of get there, sometimes in my own work, um, I explain that the pain. So, like, when we're doing this work, we're not completely eliminating pain for the rest of our lives.
yes.
Pain is the normal and important part of
Yeah.
life, and it can alert us to when things are wrong, but the word wrong is like, again, it doesn't mean there's some huge tissue permanent
Yeah.
damage or, but if you have a ton of cortisol going through your body over and over and over again, and you're feeling this physical pain, again, it doesn't mean your knee is now damaged. It just means we've got to, the cortisol is pumping
Yeah.
and the pain receptors are growing in that area. You might be able to
Yeah.
say that a little
Well,
better
yeah,
than me.
it's I mean, when you have more cortisol, just, like, literally at, like, a membrane level of the cell, that's going to basically decrease the threshold for your nerves in which they need to fire. So things are gonna that you're normally doing are gonna hurt more because maybe only half of them were firing before, and now they're all firing, and going up to your brain. And I think, though, I usually call it I think in a lot of um a little like the explain pain kind of literature stuff, they talk about it as danger signals. So like your nerves are sending up signals to your brain has to decide whether it thinks it's dangerous or not. Um, and I also usually use an analogy of like your brain kind of becomes like a helicopter parent. And it wants to know what's going on, where is it going on, when's it going to happen, what might possibly happen. So we better stop you from doing this because it might lead to that, which might lead to something painful. So that's the analogy I
I
would use
love
for it.
that.
But
That's such a good metaphor.
that's because obviously everyone knows helicopter parents are a little over the top and we need to like dial it back a little bit.
Everything's wrong, everything's dangerous.
Yeah.
Yeah. And when you're learning to be a little less helicoptery,
Yeah.
the goal is to like, you might notice that something looks a little dangerous, but you're going to kind of allow it to be there for a moment,
Yeah.
watch, wait and see. And then the idea is that you when you do that, positive things will happen that then build your trust in either your child to be able to handle the environment, or in our case, your body to be able to handle that sensation,
Yeah.
even if it is pain. I'll give an example. I've had like joint pain for my entire adult life and um no real diagnosis other than Lyme disease early on. But whatever, I have moved past acceptance and I don't need a diagnosis. Like it just
Yeah.
is what it is.
Sure.
Uh, because I do have a lot of these resources in my life to manage pain. I think if I didn't, the diagnosis would be more important.
Yeah.
But back to the story. So my knees have been really achy and I've been working out more recently. And I was talking to someone about it and they're like, "Oh, like make sure you've got like really good form." And because I have 10 plus years of experience with actually hurting myself and like not listening to my body and then listening to my body too much, I'm actually really in tune and I know I haven't hurt my knees. They're really just achy right now because they're not used to this much
Yeah.
activity. I probably need some more blood flow going through them. I'm not like moving them enough in between workouts. And I know that through working with PTs. My
Yeah.
husband's a personal trainer,
Okay.
my own. It's such a like, but that kind of pain, the achiness, it feels very much like how people describe arthritic pain.
Hmm.
And 10 years ago, it was like, I can't do anything now. I have to be completely immobile because I'm about to damage my knees. And I wasn't saying that like cognitively, but
Yeah.
that was the message that I had going on in my brain.
Well, totally. And then especially because they're I mean, the healthcare system treats treats pain anatomically based and and it treats symptoms and structures. And so if you've gone through that system, that's what it's what you've been told, that's what you probably believe, and it probably started that way. But now, now that it's been a year, 5 years, 10 years, 15 years, that's not necessarily the case. And the thing I usually tell people a lot too is these changes that have happened, whether it's arthritis, whether it's like spine stuff, they haven't happened overnight. Like they happen slowly and your body can adapt. And I also talk about that kind of like like every tissue has its like threshold, just like a person, like they can tolerate so much stress. And then when I get to that point, then there's going to be symptomatic. Like those changes kind of, yeah, they've added to the stress, but they haven't necessarily been enough to like send it over the top. So because your body when changes happen slowly, can adapt to a lot of those things.
Yeah, yeah, and it makes me think too, like, okay, so when you feel that pain, like again, your body is telling you something, but what is it telling you? And
Exactly.
that's the part that I just don't think we have enough information on, and it really
Yeah.
takes it's an intuitive learning process of learning what your body has to tell you.
Yeah.
And in order to do that, you have to stop analyzing. You have to stop saying, like, for example, with my knees, it would have been like I literally injured my knees working out.
Yeah.
And now I know, no. And actually, what I need to do is not even slow down with the workouts, but I need to be stretching more. I noticed,
Yeah.
that was through some trial and error. So, like, I stretched my hamstrings before an exercise and then I did it again and I immediately felt a difference. And I was like, okay, like,
Yeah.
this is what 10 plus years of learning has taught me.
Well, and then,
And
when you have pain, it's easy to feel like to like basically feel like your body is like either to be not to say afraid of it, but like it's failing me, or it's like I can't trust it because it hurts and I can't do this and I can't do that. So like to actually, yeah, try and get in tune and like trust it again is a whole nother skill set.
that's what we work on a lot in
Yeah.
my practice is learning to trust that your body knows what's best for you, but your brain doesn't necessarily it doesn't know yet what your body knows.
Yeah.
So our brain tends to turn those alarm bells on saying like this means danger. And
Yeah.
really it's just a sensation that might be saying slow down or get more sleep or drink more water or any kind of smaller message that just isn't as harmful as what you're used to hearing your brain tell you.
And two, sometimes just kind of trying to like, no, I don't want to say use common sense, but kind of use common sense of like, all right, should what I did, like, is that technically like strenuous enough to actually like cause damage or hurt anything? Like I was just tying my shoe. So probably not. So like these are just
That's a hard one. Yeah.
yeah,
I think
like
like a headspace now where I'm like, oh yeah, that makes so much sense. Think about it that way. Of course, 10 years ago, I would have
oh,
been like, yeah, it did hurt. Like I did injure myself. That's the problem.
I know this thing like it hurts, but that doesn't necessarily mean that it's injured. And yeah, kind of I think trying to separate that a little bit. They
Yeah.
see it as more of like a signal than that could have multiple kind of potential reasons behind it versus, yeah, like pain equals injury, damage, and stuff.
This almost reminds me of OCD treatment from the mental health perspective because in OCD treatment, I'm not an OCD specialist, but I've read enough. So if somebody listening wants to correct anything I say here, please write in and let me know. But it what it looks like to me within OCD treatment is there's kind of this like you have to stop the thoughts in its tracks, and stop analyzing whether they're true or not. Like OCD will tell you that, you wanna harm your child or you need to go check the door quite a few times, or, it tells you that these things that you need to do, or it tells you things and you have to kinda say, "No, that's not true." And I'm not even gonna try to understand where it came from or what the root cause of it is because all of that just kind of reinforces the cycle of OCD thoughts. And eventually, once you kind of get that habit down, then you can start to kind of go into um more like acceptance based work around like this just it is the I'm like losing my train of thought here. Um
It is
I
what
lost it. That's fine. There was a piece there that was
you
important, but it'll probably come back to me in 5 minutes.
exactly.
It's
Exactly.
fine.
But yeah, I think that, and I think there's a growing um interest, like research wise. I think like the fancy word for it is interoception or something of this, like
Yeah.
being able to like basically listen to your body and what it's telling you. That yeah is another whole
That's the piece.
yeah, it's like
That's the
fascinating.
piece that I was gonna end about the OCD treatment is like learning to listen to your body. But at first, you can't really do that because listening to yourself tells you everything is true, everything is dangerous, everything is. So there's phases to this treatment. So thanks for wrapping that back up with me.
That's well, and too, I mean, pain is like like becomes a learned pathway. So I think of it like, initially I think of it like the Oregon Trail, like when you're first starting to have pain, like these, it's kind of trying to find its way. But when you've had pain for a while, it's like the Autobahn, like it just zips right along because it has a really well defined pathway. And basically we're just trying to create a new different pathway. So it takes a while.
Yeah, yeah, and it's gonna be hard because you're on unpaved road. Yeah. You practice from principles of
Oh,
imagery. Can you tell me
yes.
a little bit about that and,
Yeah.
what that looks like?
So it's kind of a well, not really a philosophy, but it's basically based on the kind of neuroplasticity and kind of just the science behind how like persistent pain works. And I think of it kind of like basically trying to train your nervous system that a lot of these things that have previously been thought that either should be painful or dangerous, or might be, you're kind of trying to sneak in under the radar a little bit. So and change things that happen that you don't realize are happening when you're in persistent pain. The changes that happen at kind of the cellular level have a few kind of like byproducts that we can actually assess to a certain extent. That's the challenge with with a lot of persistent pain is you can't measure really other than like an EMG that measures like nerve conduction. There are no tests to measure how your nervous system is working. But when you've had persistent pain and some of these physiological changes have happened, interestingly enough, you will sometimes have issues telling right side of the body from left side of the body. Um, or you might also like, especially in an area of pain, you may have like, if you like drew a grid on your back and had like 1 through 6, and someone just points to the different grids in your area of pain, you're going to have a harder time discriminating against that area than if someone did the same thing on a different part of your body. Like you'll probably get really accurate on areas that don't have pain. But if you do it over the area of your low back where you have pain, you're not going to be as accurate. So we have some of those. So basically looking at some of those kinds of things to assess like how like really how sensitive are things or how fuzzy is that communication. And then literally like turning those things into like the treatment or the exercise to basically sharpen those things back. And then interestingly enough, there is an element which to me sometimes still seems kind of woo-woo, but it makes sense. There is like an element of like visualization and imagery of um let's say bending down to tie your shoes is always painful. Actually visualizing yourself doing that, noticing all the sense, but visualizing yourself doing it without pain and noticing like how easy it is and how, you bend over so easily and your back feels really flexible and it also feels really strong. And it's, I know it, like I said, it sounds like a little bit kind of woo woo, but it works. I mean, a lot of professional athletes use this all the time before they're going to go do, an event. And I had heard this story a couple of years ago, which I just thought was fascinating. So Greg Louganis was a Olympic diver, probably like 15, 20 years ago. But in one of the Olympics, he was doing the diving, the ones that don't bounce, whatever you call that. Is it platform diving? And he on one of them hit his head when he did the dive. And when he was doing an interview afterwards, I found this fascinating. he told the person that like he'd been doing his visualization. His coach had kind of interrupted him with something. And in his visualization, he had seen himself hitting his head. But since his coach interrupted him, he never had the chance to go back and redo it. And then he went out and he hit his head. So like
I
it's
I
very
so believe that. And one, the science around this from a sports psychology research perspective is like beyond 10 years old. Like we've it was really interesting when I first learned it in a sports psych class. I was like, wow, this isn't woo woo. This is like people do this and use this. So we've been doing this for a long time. It's just not mainstream knowledge. But all the time, if I'm in the kitchen and I just imagine that maybe I am about to spill something, or like it's like an automatic thought. Like I'm not trying to imagine it, but it's just a quick thought that enters my head. If I don't quickly replace that with an intentional visualization of me doing the thing correctly, I will drop that glass, or I will like cut my finger or something while I'm cutting vegetables. Like this happens to me all the time. And because I do have a lot of these automatic thoughts that kind of creep in, pop in
yeah.
through my own work with a lot of acceptance and commitment therapy and mindfulness and all of that. I've I live a normal life, but it's those thoughts still are very automatic and happen all the times. I use visual imagery all the time to course correct.
Yeah. And we now know that there's this element of activating the mirror neuron system, which, by the way, is the same reason why you yawn when someone else yawns. Is because but it basically so we're using that system because basically what we know is that thinking about doing a movement or an activity activates pretty much the same nerves and neurons in your brain that actually doing the activity does. So this is a way that basically we're retraining the brain. So we're activating those same pathways that would activate when you would do the activity, but we're activating it without the pain being reproduced. So
Yeah.
then like I said, we're kind of trying to get in under the radar and reestablish kind of those different connections that if we continue to practice it, start to kind of replace the old ones.
They've done some research around this. I think they call in the literature it was mental imagery training. I could have gotten that term wrong, but they've done some more research around this, and there's a kind of a training program. Andrew Huberman talks about this in one of
Hmm.
his podcast episodes, like a 2 hour long podcast episode. But um, basically, when you're doing this mental work, you have to have the physical component along with it to kind of help connect the two. Um,
Yeah.
but if you're in a place where you're still too scared to, bend over and tie your shoe because your back tweaks every time you do that or whatever, then the mental imagery is where you need to start and do that until you get the nerve to try to tie your shoe and mix
Yeah.
it with the imagery and
Yeah.
yeah.
And that's too where some of the newer stuff coming out with the PRT, the pain reprocessing
Pain
therapies.
reprocessing therapy.
Yeah. And so that's kind of where I think where a lot of that is kind of based in as well.
Yes. Yeah. I think that that's really fascinating stuff. I know I did read The Way Out, which is
Oh,
a
yep. Yep.
great
That's by yeah.
PRT.
Yeah.
Yeah, he's kind of one of the main people in that world right now. I remember feeling it was a little bit too CBT for my taste, like too much like change your thoughts, change your life kind of
Well,
thing.
and
But
I'm
there's a lot of
I
research
think it
around it.
I think it has I don't again, kind of like when talking about like explaining to kind of people how chronic pain is different. I feel like there's a lot of people, if you just jumped right in there, are going to be like, well, you're just telling me to basically not listen to my body and not do like, so I feel like to me, that feels like that's ultimately a transition that needs to be made is, going through those movements with the mindfulness, with the awareness. But like, I feel like there's a lot of work to be done before that to get to a point where that's really going to be appropriate and successful.
Yeah. Yeah. You can absolutely always pass on any question, but do you have any persistent pain yourself that you've worked through or that you still sometimes have to work, anything?
Yeah, like, knock on wood, no. I
Okay.
mean, I have, I'm 48, so I have just like the daily, the intermittent stuff. I did go through, um, was diagnosed with breast cancer at the end of like 2017 and went through treatment in 2018. So I feel like I have some sense of like going through difficult medical things and not really knowing what the outcome is going to be and having to get through it. But I personally do not have any persistence. I have family members with various things. Like my stepmom actually my stepmom and my mother-in-law has fibromyalgia. Um,
Mm,
but I've come
yeah.
at it from more a perspective of of stubbornness and being a little bit of a nerd in that like I refuse to believe that like I would not be able to help like every single person that I ever met. Like so I'm like there has to be something I can do. And just loving like science and research. So like if I can't solve this problem, I'm gonna go on PubMed and see what the research is and try to figure it out. So, having this group of people who so need help that I'm not really helping, and then kind of going onto a mission to figure out like there has to be something I can do. That is kind of where all of this kind of came from.
Okay. Yeah. Yeah. There's always a reason somehow, some way that we
Yeah,
get into this. And I really think it's the compassion piece. I think people talk a lot about lived experience. And I think the reason why lived experience is so important is because it gives you the compassion and it
definitely.
gives you the belief. But if you have the compassion and you do believe the people in front of you and you are, working from that framework, I know that that's all that matters.
Yeah. Well, I mean, and I work the clinic I work at in Minneapolis. We have more, a population compared to the PT clinics in the suburbs. There are just a lot more like psychosocial like issue, like literally like, do they have a ride that they can get to the clinic, or those kinds of things. And we've had therapists that come in and don't last very long because they just like they went into this to, treat, the weekend warriors and the athletes. And, I've had some of them, kind of ask like, well, how do you do this? And I'm like, well, number one, like I give person the benefit of the doubt. Like this person is doing the best that they can in the situation that they are in. Like, you try being them and going home and living their life with what they're dealing with and 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 see where you like it, kind of
Yeah.
thing. I'm like,
Yeah.
and then my overall arching goal is just to like make a connection and like because like is yeah, so like let's make a connection and give the benefit of the doubt and go from there. Um,
Yeah. That's the only way you're going to actually get through to anyone. And
yeah,
yeah, if you're working from the lens of how do I help you? How do I help others? Then you're thinking about them. But if you're going into it saying like, what do I want to do in this career? And I want to work with athletes or I want to just make people better, like then you're focused on you. And that's a really quick road to burnout.
yes, and I sometimes think like I've tried to figure out, and I mean that's what I honestly think when I think of just so much of like the gaslighting that goes on is I think it's just providers not knowing what to do and not feeling like they can help. So instead of like taking that as kind of their thing, they're kind of turning it onto the person sitting there in front of them asking for help. And like,
Yeah.
well, and so instead of being like, well, I really don't know what to do, being like, well, this doesn't fit what I know how to do. So obviously there's something wrong with you,
Exactly.
kind of a thing.
Absolutely. Yes. That I think is probably the biggest thing we talk about this. on this
Yeah.
podcast when it comes to like providers not understanding is it comes from their own ego. And when you put your ego aside and you're like, this isn't even about me. It's not about me curing. It's not about me fixing.
Yeah.
It's really just about connecting and
Yeah.
getting to know
Can
the
you just,
person in front of
I
me.
mean, what's wrong? I think someone would much rather have you say, this is what I know how to do. And I don't think any of the things I know how to do are going to help you. That would be a much easier and like kinder approach to things.
Even in the way you said it, it shows your ability to kind of tap into what the other person needs to hear because I think I have heard complaints of people being told by their doctors that their doctor can't help them. But I think the way it's said is like still from a place of like, you're unhelpable.
Oh, yeah. Yeah.
But the way you said it is like, this is my knowledge and skill set, and it is not what you need.
Yeah.
Therefore, let me help you find someone else or refer
Yeah.
you out in that way. And that's just, it doesn't take much more. It takes 2 extra seconds in the conversation
Yeah.
to add in these little filler words that just let your client know or your patient that it's not them.
Yeah.
It's just this particular puzzle piece isn't what they need at the moment.
Yeah.
So, yeah.
And
Thank
I don't really know. I've tried to contemplate, like, I don't really know what to do about it yet because quite honestly, like, the healthcare system is not set up to like deal with this at all. Um, I mean, just look at orthopedic surgeries. Like, how much can we tell? Like, there's been more than one study now that has looked like it at knee arthroscopic surgery, where they've, had one group where both groups, like one group, they went in and actually did what they said they were going to do. And like the other group, they just like made the incisions and they went in but they didn't do anything. Both groups have similar outcomes. So, but yet my mom was like 73 and just had a hip replacement, clearly needed a hip replacement. Like, and she's had it and now like, so how much it's kind of hard, like, and sometimes the structure is an issue, but like a lot of times it's probably all of the other things that's going on in someone's body and in someone's life and how we tease that out. And then how we tease that out in a formal process so we can actually decide who should get what is um, a big,
it's kind of an impossible.
yeah,
It's
yeah,
impossible, really. I mean, I think that's why there's so much error
yeah,
in medicine and also in non-medicine. People decide to not get treatments for things and
yeah,
that wasn't the right decision or it is it is hard. There is no answer, and I think that that is the crux of it. We're
yeah,
taught in school that there's always an answer,
yeah,
and life just has shown us that there just is. Like,
yeah,
there is. So that's the basis of a lot of my work is acceptance work, which can
yeah,
often sound like you're just being told to tolerate this and you'll live with this forever. But really, it's like when we just stop fighting the fact that it's true that pain lives in our body and stop trying to desperately claw for answers, that alone, if we stop doing that, that alone reduces the cortisol in your body. So that already starts to
yeah,
fix some things.
yes,
Um, it also lets you think a little bit more clearly. And I know for me anyway, that has helped me find the right treatments for me, the right exercises, the right, and when I say right, like again, I still live with pain, I still have pain, but there isn't a suffering around it anymore.
well, yeah, yeah. Because so there's a quote that like pain is inevitable, but suffering is optional.
Yeah.
And I too think, well, I think someone gave like the definition of like surrender as like you're not giving up, you're just not fighting anymore. Like, that doesn't mean you're not doing anything. It just means there's not that huge like resistance and pushback.
Yeah.
Um, and yeah, I think it's again, it's a sensory and an emotional experience that are
Right.
combined, and it's there's no one. Um, like I've had people tell me that I'm not qualified to diagnose, treat. I'm like, you're right. I'm not. qualified to diagnose. I'm not saying I'm diagnosing, and I am not saying that I have the answer and that I can help everybody. But I'm just saying, like, this is the science of how this works that most medical providers either aren't aware of or don't know what to do with. So it's not being addressed. And I'm perfectly qualified to address this component of the whole pain puzzle.
That's how I feel too, more on the emotional, mental side of
Hmm.
things. But yeah, I love this. And you have so you work at a clinic, but you also have a program too,
Yes.
right?
So so I have kind of this 2023 has been my year to finally get my act together, to finally have the thoughts kind of come forth into fruition. So I have it's a 14-week online program, the chronic pain recovery method. So there's curriculum that moves through the steps of understanding how pain works, then working at kind of calming the nervous system, and then getting it kind of that retraining the communication pieces. So there's the content, but then there's weekly um, live like coaching calls. So to kind of go through like what do you bump up against? How's it going? Well, maybe we need to tweak this because like pain is different for everybody. And there's definitely a common framework of major points that needs to be addressed, but then everyone has little tweaks that kind of need to be made to get the most success of it.
And is there a physical, just your background as a physical therapy, is there like
Yep.
a physical component to the program or is it
Not
just emotional?
not much. Um, there is a physical. I do address movement in general, and more some like movement or exercises related to like nerves, nerve mobility, decreasing the sensitization. And again, talk about just how movement in general is important, but I don't actually like I'm not giving you this list of exercises to do and you need to do all of these because which a lot of people have experienced when they've gone to PT and it makes things worse. If you're trying to do these things on top of a sensitive nervous system, it's going to send you through the roof. So getting the nervous system more regulated and the communication better, then you're actually going to be able to kind of get back into some more of those kind of regular exercise routines that you've done in the past without sending your pain through the roof.
It's so interesting because so basically for the last 10 years, I've just kind of, if I have worked with doctors, they've been out of pocket, either functional medicine or naturopathic, or even like a physical therapist who's more out of network and a little bit more holistic.
Yeah.
Um, and I think since I now have such a solid foundation around like not fearing my body, now I was wanting to get back into physical therapy. And I did look for someone in network because it will save me money, but I'm at a place where that isn't gonna be harmful for me.
Yes.
And I think intuitively I knew before that it was gonna be harmful for
Yes.
me personally.
Yeah.
Because I needed that holistic approach. If I had just gone and tried to do the exercises, I would have hurt myself or quit and felt like a failure,
Exactly.
all of that. Whereas now I have this kind of intuitive knowing where I can take what she gives me and I understand like what's important and what's not from that.
Yeah.
So
Yeah. And it's a I mean, it's a huge like I said, I get lots of people who, have, some trepidation and skepticism because like they've done PT before and every time it makes things worse. And I'm like, you're right. I'm not surprised. And like, this is why. And this is why we do things this way. Um, so I mean, and it's a like I graduated in 1999. We knew nothing. Like, I remember, like, there's, like, one sentence in our neuroscience book that was like, "Pain travels down the lateral spinothalamic tract," like, period. Like, that was about it. So, like, it's a huge amount of knowledge that has come about in a relatively quick amount of time. Again, it's things I've had to seek out separate from like you have to look for it and you have to seek it out. It's not something that is just kind of trickling into mainstream medicine for that point. So
Yeah, and it sounds you mentioned earlier explain pain. It sounds like you've learned a lot from Laura
yes.
Mosley.
And
Because
the NOI group with David Butler is kind of the other big
yeah,
group that is into a lot of this. So it's it's fascinating stuff. The tricky part is figuring out how to best translate that into like techniques in the clinic. But it's never
yeah,
boring. That's what I like.
yeah. No, that's
What's up all
good.
the
I love that. Yes, awesome. Well, it sounds like you have a lot of good stuff. I know people can find you on Instagram, the
yeah.
Annie Toth,
I'm at the
um, TikTok, chronic pain relief specialist, and then
Yep.
a free guide. I'll link all of that below.
Okay. Perfect.
Um, and is there anything else you want to kind of leave people with today? Any kind of last words or thought?
I just I think two of the hardest things for people who have persistent pain is hope, and trust. And I think hopefully the fact that, if you're listening to this, you have some hope. Um, and there are people out there that you can trust. Like you're probably not going to find them the first time you go somewhere. And there unfortunately is no like directory of people who understand how this works. But like if you find someone and you're not clicking with them, like keep keep looking because there are people out there um that do know what they're doing and do want to help. And so don't give up would be my
Love that.
message.
Great. Thank you so much for being here. I
Yes.
really appreciate it.
No problem.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then.